about being a parent of a child with liver disease and the ups and downs, and maybe even some tips for some of you that might move from the pediatric liver clinic over to the adult. So please welcome Carolyn Kwan. Sorry, I have to take it. It's either I read my thing here or I can't see you. Can't see both. Okay, so my family's introduction to the pediatric world at the Children's Hospital was when my husband and I brought my firstborn baby to emerge. I don't know why. The urging of our doctor because the whites of his eyes were yellow. And he was jaundiced. What we thought would be a quick put him under the lamp scenario became a 2.5-week stay at the hospital. It was during that stay that our lives were turned upside down, and we learned at the tender age of 8 weeks our son Dylan had biliary atresia. Biliary atresia is a rare pediatric liver disease that is chronic and progressive. Currently has no cure. He underwent a life-saving procedure called the Kasai at 9 weeks, 63 days of life, to help restore bile flow. It's not a cure for biliary atresia, but it helps slow the liver damage or prevent complications and the need for a liver transplant. That's not working. I don't have stats, I only have pictures. Okay, so this picture is of Dylan when we were at eMERGE, when we didn't know what was happening. So you can see that he was pretty jaundiced and pretty lethargic. During our stay at the Children's Hospital, we had nurses that cared for him and checked on us. And I remember one nurse who even brought me toast and juice because I hadn't eaten anything. I wasn't the patient. And we met 3 GI doctors at the time. At that time, there was only 3. There's a lot more now. And they would come back to check on us every day. And one of them eventually became Dylan's GI doctor for his entire care at the Children's Hospital for 18 years. So this is when he was admitted, and they were doing all sorts of tests to confirm that it was biliary atresia. And then he received his Kasai. There's his scar there. The scar is amazing. The surgeon did such a great job there. And following his stay at the hospital, we had multiple visits to the labs, clinics, and diagnostic imaging. Dylan had a nurse we could call anytime with our concerns or questions. And for the first year, his nurse at the time was Anna. She would call us every time he got his blood work with the results and just let us know how the numbers were trending, whether or not they're increasing, decreasing, or if they're stabilizing. At that time, I became obsessed with charting his lab results, and then I would fuss over why it wasn't normal and how we could get it there, but then I came to realize that it may not be my normal, but it was Dylan's normal. And this new normal is something that we needed to accept. And then throughout his 18 years under the care of Dr. Robel, the Children's Hospital, he was hospitalized with cholangitis a number of times, bacterial infection that affects the bile ducts. And we have also visited the Stollery Hospital in Edmonton to talk with the transplant team twice. I feel like Dr. Robel wanted to prepare us for the idea of a transplant if he kept getting cholangitis, and with each clinic visit, she would also prepare Dylan with how he would describe his condition to doctors that were not familiar with his medical health history. And it's just him as he got older when he was admitted for cholangitis. One time, our family went on a cruise for a week, and then 4 days into the cruise, Dylan exhibited symptoms of cholangitis, which was he was feeling lethargic, and we panicked because the doctor on the boat had no idea what we were talking about. They were able to draw his blood, but they didn't know what to make of his elevated liver enzymes. So my husband called the GI doctor on call at the Children's Hospital, and they were so great. They recommended 6 different drugs that he could potentially take to see if they had that on the boat, and they had one of those drugs on the boat. So he took it and he started to feel better. Luckily, we flew home 2 days later, and Dr. Robel got him to draw some more blood and just make sure that things were okay. And then being at the Children's Hospital was like our second home. That's him with his sister. It's an interesting feeling there though, because you don't want to be there, but at the same time, everyone there is so loving and they're familiar with Dylan's journey, and you feel that they have your back at all times. So being there is also very comforting. Imagine our apprehensiveness when Dylan needed to be transferred to the foothills because he was turning 18, and we didn't know how to feel moving from one family we've known for 18 years to a new family. And Dylan's last clinic visit was very emotional, mainly for me. This is him. See, he's like taller than his doctor now. We were told that the transfer papers were sent in and we would hear from the liver clinic here at Foothills. In preparation for Dylan's first appointment at the hepatology clinic, we mentally prepared for the fact that Dylan would need to advocate for himself more. We stressed to him the importance of speaking up and seeking help if he is not feeling well, especially with cholangitis, because normally he would just say, oh, I'm just gonna sleep it off. But now he knows how that feels like, that feeling of being really tired that he can't even walk to the fridge, that he knows that that's probably cholangitis and that he could seek help for that. He knows that, we told him that he knows his body best and to not ignore certain symptoms if it arises. We ensured him that it is okay to ask questions and seek understanding regarding his health. We advised Dylan at 16 with Dr. Robel's recommendation to start making his own appointments for lab work and be responsible for ordering his own medication. He's a very responsible boy, so we knew that he'd be okay with the transition. He was becoming the independent and responsible young man that we knew he would be. We accompanied Dylan to his first appointment with his new doctor here, and it was amazing. We feel very fortunate because Dylan really liked his new doctor. I initially put he vibed with his doctor, but then Dylan was like, vibe, ew, mom. Like, so I'm like, okay, so I'm just gonna say he really liked his new doctor. He said he liked his doctor's approach and his personality, and that was very important to us, that he could connect with him. Dylan felt so comfortable with the transition that he even contacted the clinic shortly after to ask for advice regarding how he should prepare to go to his first international trip to Korea with his friends this summer. In case things were to go awry. He even made a clinic appointment by himself, which I had no idea about. The clinic called him and asked if they wanted to change the number from mine to his, so they made that appointment with him. He told me last minute, and so I couldn't attend, but I asked if he could take notes and make sure he tells me everything that was discussed. He came home from that visit with something better. His doctor actually wrote up what was discussed during that visit, and Dylan let me read that report, and I really appreciated that from his doctor, that I wasn't totally pushed out. I admit it's hard seeing my baby go through so much. This is a picture of me and him at our last day of the clinic, and so my face is all like this right now. So I admit it's hard seeing my once baby going through so much, taking care of him and needing me to advocate for him, scheduling all his medical appointments, charting all his blood work like some wannabe mathematician. I don't know why I charted his blood work, but I did. Somehow, like as if I can control those numbers. But seeing him advocate for himself and using what he learned from Dr. Robel was a proud moment. And trusting the process, changing, growing, and building new relationships is what life is all about. And one day, if and when, I know some doctors, they say when, but I like to say if he needs a transplant, we will cross that road when it comes. But in the meantime, we are enjoying this new normal and learning every day how to navigate it. And he just graduated.